All right, good morning again, everyone, and welcome to the sixth webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. Today, we'll be learning how to communicate who you truly are as an organization. My name is Robbie Nato, and I'm a program coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. We designed these webinars to be interactive, so we'll be asking you to complete some polls and participate in some chat box discussions. You may also unmute your line and use your voice to speak. We'll be using a PDF handout for a brief exercise today. You can find that within the Outlook invitation for this webinar. And if you haven't done so already, please add your name, title, organization into the chat box, which you will find on the bottom of your Zoom screen. Today's slides for today's webinar can be found on the event page, and I will put that link in the chat box here shortly. If you have any questions or comments today, feel free to use the chat box at any time. We will save some time at the end of this webinar for our speaker to answer any questions that come in through the chat box. And to avoid any noise and background feedback, please remain muted when you're not speaking. Now let me introduce you to our speaker, Brian Lottie, Vice President of Creative Services at Legato. Brian comes to Legato with decades of healthcare communications expertise, most recently as the Vice President of Brand Strategy for Prevea Health and HSHS Eastern Wisconsin Division. Brian has been an active participant in the AMGA Leadership Council. Over the years, Brian has combined his creative skills with business leadership as a creative director and agency owner. He holds a Bachelor of Fine Arts degree from the University of Wisconsin-Eau Claire. Thanks for joining us today, everyone, and I'll turn things over to you, Brian.
Hey, thanks, Robbie. Again, thank you to the National Rural Health Resource Center for inviting Legato to partake in this 8-week educational webinar series. Obviously, with that, being a part of the Delta program, we're hoping that obviously this is the 6th week of the program, that you've had the opportunity to learn a number of things along the ways. With that, we've covered things such as trust and confidence, planning, really elevating your communications role in your organization. I learned about culture and diversity, and then this last week we did one that was based on digital. So with that, obviously this week's we're going to lead into something that's a little bit more based on your image. It's for your organization. So with that, this week's seminar is, what is your organization's image? We're going to talk about that. We're going to look at what defines the character of your organization and what that means with that. Why consistency in the way you communicate and the way you present yourself is important. And then, as mentioned, Robbie mentioned that we have an exercise we want to go through that's a personality exercise. It'll be something that hopefully you've been able to grab that PDF, but we'll talk you through that, and we'll take a little bit of time to go through that and go step by step. But it's part of what we do as an organization to really help other healthcare organizations define their image, their identity, and their voice for others. So, and then ultimately that last piece is, it's kind of that gut check. Is it time for a change of your image? You need to evolve based on where you are today. So we're going to start things out with a polling question. And obviously, as you know, we do this at the beginning and at the end. But the question is, how confident are you in understanding how to define and effectively communicate who you truly are as an organization? And you're going to have a number of options, much like before. And so Robbie's going to put that up on the screen, and then we're going to see, kind of get a sense of where everyone is real time. Do we have those, Robbie?
Yep, looks like we're at about 25 of 39.
Okay.
Ready to close?
Okay. Yep.
Right.
Yep. Good. Good. All right. So leading into this, I mean, obviously the number one thing is all of us have an idea of at least what we think our image is all about. You can say that personally too. what you think your image is, who you are as a person. But when you think about it as your organization, you have an idea of what that is. But I think the big thing is with that is that your first reaction may be, it's my logo. That's my image. That's my identity. And we have to think beyond that. It's much bigger than that. It goes well beyond the colors of your organization, what the logo is, what your tagline is, you know, what the theme of a campaign may be that you're communicating out at that time being. The message that you're sending to your foundation could be one thing that is actually an image. And it goes beyond the bricks and mortar. So with that, when you look at it, it's a combination of things. You know, you say, look in your mirror, what do you see? Well, everything that's off to the right is what people are seeing about your image. It's your culture. And we have to look at this as being inside and outside. We have to look at this as being positive and negative. Not everything that you put out there is going to be the way you want to reflect, but it is going to be an image that people portray you as, your personality, your purpose, your environment, really the makeup of the services that you offer your community, the reputation, the long-standing reputation that you might have that, you know, someone may say 10 years ago, I had this experience. Well, that's the image they have of you. How you differ from your competition. Again, heritage. And then ultimately bringing this all together, it's relationships, and it's also how you fulfill your mission as an organization. So you bundle all that together and you got to say, well, what is that then? Well, ultimately, it's a promise. It's a promise that what you are going to fulfill to all the audiences that you speak to. And it's their expectations back, that when you look at that list that I gave you before, you're really building equity into one promise to that they're going to feel. So what I want you first to do is I want you to think about, this is a question I want to put out there, and you can put it in the chat box. If you want to, open up your microphones. But name a business that you recognize and you respect for their image, but then also for their promise. And I'm not just talking healthcare. This could be, you know, any business that you frequent, anything that you think of like that. So just take a few minutes here and just kind of think about that. And you should quickly know of something. And I'm not, right now, Robbie, if there is stuff coming up on there, if you want to just share, if you see anything.
For sure. So far we have Coach, Chick-fil-A, Ascension Health, Walmart, Chick-fil-A a couple more times.
Yep.
Amazon.
Those are, yeah, great. And with each of those, you have to think, there's probably something that comes to mind too. I mean, Chick-fil-A opened here in town a month ago, and I think the west side of town was shut down in the amount of traffic that was trying to get there. Why? It has to do with their image. You know, a lot of people may have never even experienced Chick-fil-A, but they have something in their mind that I got to go there. I got to give that a try. So I'm going to bring up some other organizations. Obviously, you mentioned Walmart, but with that, each of these that are on screen, these are consumer organizations. You obviously are very familiar with all of these. And it is something that each one of these recognizable businesses has a promise to them. It's what they stand for. And it may be that promise may not be exactly what you feel, but they have to deliver on that promise every day with that, whether it has to go with the products that they provide or the service that they're providing. That experience that consumer experience that they go through, because these are all consumer based. With that, that's what they have to deliver on. And I'm sorry, I'm going to use a little cheat sheet here on this of what these promises are. But when you look at Starbucks is basically what they're trying to do is one cup, one person, one neighborhood every day. Some towns it's like one block, but it is that experience they're wanting to deliver on each and every time. Harley is the journey like no other. It's an experience, no matter where you live, no matter who you are, and really no matter what your age is either. Amazon, obviously right now, I'm sure many of you have been either visiting Amazon or Walmart or whatever during the Christmas season. But with that, they're delivering the broadest selection of products at the lowest price and with minimal hassle. Through COVID right now, minimal hassle, we're all looking for minimal hassle. And obviously the opportunity to go and experience shopping the normal way, for many, it's not there. Amazon is kind of the go-to, and it has trust that is connected with their promise that you're going to get that product. Disney, where dreams come true, obviously. But I think the thing you have to think about also with many of these organizations, their promises are evolving. Their image is evolving. Disney hasn't been just in the mold of what Disney has always been. Disney evolves constantly, looking, where do I go next? I mean, Disney Plus still is it's creating happiness, and it's allowing those dreams to come through, but just through a different medium. Apple is kind of the same way, that when Macintosh was introduced initially, Apple really was bringing technology forward in a different way. But it was also in their promise is saying they're wanting to inspire their customers to do the same. So they're providing you with the tools and the technology and the creativity to go further. And with Apple, when you think about it, they've changed the way that we exercise, that you're monitoring that. Obviously, some of that's carrying over into healthcare now in regards to all of that instrumentation of managing health is coming from organizations like this that have taken their promise and pushed it further with that. Walmart, with Walmart, theirs is, let's see, it's the promise to inspire customers to do the same in regard, or wait a second, it was the other one, saving money and living better. Very simple, but that's what they live by. But Walmart, saving money and living better, they've taken it from basic consumer goods to food products. And obviously they too are, from an online standpoint, doing just like Walmart is doing. So how does that carry over to healthcare? I'm only going to go into a few of these, but obviously when you see each one of these on screen, I would guess that for all of you, you have a feeling about what these organizations' promises are, or what people perceive the promise is in regards to that. Mayo it ranks as one of the best from a consumer standpoint, from a patient standpoint. But when they look at it, from their promise, it's worldwide regard that Mayo wants to be one of the best to treat illnesses. And that carries forth into that. WebMD has earned their promise over time. They've been kind of that go-to source for people that are self-diagnosing, that they want to know what's going on. But I'm not ready to commit to go to the doctor yet. I'm not ready to go to an urgent care. I've got knee pain and I just want to get through it. I'm going to do it myself, but I also want reassurance of what it might be. Or I'm going to take it to my doctor and say, well, this is what WebMD said, which I'm sure many of you have experienced. So they have that information, that core information that they share. Epic Systems, obviously for each of you that you know, it is a powerhouse when it comes to the IT standpoint. They're one of the most well-known names that are there, but they built that, and they built it through innovation and how they connect with organizations like yourselves. So, that's, I think, bottom line, when you look at all of these, whether it has to do with the consumer piece or it has to do with, looking at a business organizations that you work with, it's the experience that we're going through. Everything is based on experiences. So with that, let's bring it back to you as organizations, as rural health organizations. Experiences, quality of care is obviously at the top of the list with this. When we talk about the quality of care can base on quality outcomes. Obviously you want to provide the best outcomes to your patient base, and that's an experience for your patients. They may look at it as quality of care is the service mix that you have. which is important to build that awareness of those services in order to build your image of that. And then the other piece is personal opinion. I mentioned it before that someone may have, or a lot of times it's, I have a friend who had a relative who walked through the door of that organization 15 years ago and this happened. Well, that affects the quality of care that's provided. It affects the experience of that. So with that, it is something that, you know, we have to take a look at every interaction that occurs with that. On the opposite end of it, it can be the positive piece of it that is carried forth, the word of mouth that's there. Patient interaction kind of is the same piece. It's really how you treat each other. What's the respect that's there? It can be a doctor. It can be a nurse. It can be an administrative person walking through the hallways. It's a volunteer. It's someone doing maintenance throughout your location. Every interaction of those interactions that occur, we're looking for consistency with that, and we're looking for positive interactions with that. So from a patient standpoint, you know, this is the worst time for them. You know, as a business, we look at it as a positive thing. We've got positive business. They enter our doors, there's a good chance it's the worst point in their life that they're going through, and they're needing that positive interaction. You know, this connects to the previous one, but it is, how do I answer the phone? You know, there are hard days when you've got a line of people standing in front of you and they all want answers and they're waiting to be checked in or whatever it might be. But that interaction, that image that you're portraying, you don't want to feel rushed. You want to be as helpful as you can and provide direction. That customer excellence really plays into your image of how you do that. That service excellence that occurs. So that's part of it too. Obviously now, big change. Rural health and having the opportunity to have access to telehealth, especially at this point in time. And we will be, the next webinar is going to be focusing on telehealth. My understanding and talking to the Resource Center for many of you organizations that are on the line, this is a step in the direction of where you're going, or you're starting implementation of this. But as part of this, we have to think about the technology and the access to that care is one thing. We always feel that if there was one part that if anything you want to do is you want to make it easy. And the second thing, you want to make sure that the individuals that are in your face on the other end of it, they understand how to communicate. And they're, if you want to say, trained a little bit. They know medical, they understand it. But do they know how to talk to a screen and realize that there's a human being on the other side of the screen that is really looking for that human being on the other end? That removes the barriers of feeling like my image of your organization, it's now not what it was because I've lost that human contact. This is the human contact they're looking for. So you want to make sure that it's just as warm through the technology as otherwise. Waiting room environments play into this also. Is it a consistent feeling from clinic to hospital? So does it have that same vibe all the way across the board, that that's your image? Is it comfortable? Or is it, I'm sitting here, I'm nervous, I'm in an uneasy chair type of thing? Is it lines? You know, I don't want to wait. And with that, obviously right now, we're not feeling that as much, but you know, it will play into it. And again, is it loud or is it calming? If it's calming, obviously this is something that I want right now. So with that. Community-minded. With being community-minded, I think for most organizations, you really look at what the need is of the community and how you respond to that. But that's your image with that. That's your identity. That's the way others are going to think about you, whether it has to do with an organization of need that you're helping, if it's the business community that you are assisting and really providing guidance to, or really making a healthier workforce with that. So it's all tied to that. And then ultimately, this is where we are today. It's the online experience. Aaron, during our last presentation, dove into digital in regards to kind of what the needs are and where you need to be and the knowledge of, what it can bring to your organization. But that experience is really, they're looking for convenience. They're looking for a go-to source, whether it has to do with they may not know your organization, but they're going to actually land there. And with that, you want to make sure the experience is a positive experience. They're able to find the information they're looking for. They're able to find a provider, even just the directions, the proper directions on how to get to your organization or how to pay a bill, whatever it might be. But that's a piece of it. So it's quite a bundle of things, and I'm only just scratching the surface. But really, when you look at it, these experiences, really what they do is character builds these experiences. How your organization, as I said, is perceived. It's your personality. Are you reaching out to me? Do you care enough to actually reach to certain regions with that individuals are seeking care? Are you empathetic? We talked about diversity a few weeks back, but when we look at it, both internally and externally, how are you adapting and really caring for diversity? And when we say that, it can be, when we look at the culture, it is of age, it is of color, it is of really an understanding of individual needs, and really what they've grown up to be used to with that, so that you are providing a service that matches that. It can be language, it can be anything. I mentioned community needs, but then ultimately your character needs to align with your vision and really look to the future of your strategy. Your character may match who you were, but you constantly need to look at it and say, is that who we are today and in the future? Because you got to keep staying one step ahead. So when we think of character, this is one more question I'd like to throw out to you. And again, this is a quick answer. I'm not looking for, to just sit and think about this. But think about 3 words that really define the character of your hospital or your clinic.
We have excellent, personalized, and compassionate.
Mm-hmm.
Hometown, close-knit, caring.
Those are good.
Family, quality, community.
Mm-hmm.
Friendly, family, caring. Caring, professional, serving.
Okay.
Quality care, personal, home-like, caring, caring, compassionate, community-minded, helpful, friendly, compassionate, personal, caring, and friendly.
Mm-hmm. Okay, those are good. And the thing is, what you heard was there's some very common words that are threads through there. You're hearing that there's the reference of being close and being hometown. Caring is a word that's there because I think it is something that really defines your character, but you got to be careful that and we're going to talk about this when we get into personality, that many can be caring. So we want to make sure that when we look at words that really define your character, these are words that almost push you a little bit further so that you're not just the same as another person or another organization's character. So we'll talk about that a little bit here. So we already have talked about experiences and how that affects your image, because it is. But we also have communications. Communications in combination with experience really strengthen your image together. It validates that. It brings forth that it may build awareness, which I'm going to touch on, but it may at that point say, this is the action we want you to take to experience this. Now, the reason I say that is you need to make sure, if we're up in this area of communications, we're speaking about experience, we better be able to deliver on it. because these two are reinforcing each other. And when I have a call to action that's telling me to make an appointment, to contact this number, I want to make sure that I have access to be able to do that and be able to have positive experience, that I'm able to get in and see that provider. I want to be able to, again, as I said, if I'm sending them to the website, that communication is sending me to the website to experience something on your services, that again, I'm experiencing how I can find the information and it takes me there. So with that, what can happen then is, well, these within the green setting, communication and experiences are creating your image. Your image is then pushing out and starting to build stronger awareness through that communication. And it's also starting to build your character. So it's pushing back, it's expanding out with that. With that, it's leading to, I guess, what I would call the sweet spot. Sweet spot is the equity. It's preference of your image, preference of your organization. Because as people lead through all of this, we want to make sure that our image is really hitting that sweet spot. And I'm not just talking patients. I'm talking about, it can be your staff that they believe in you. That your organization is what they believe in. It's the patients, yes. It's the referral community with that you're looking for those referrals to be coming in, but they need to believe in your image and your organization. And all of this, again, as I said, plays into that. And then ultimately, recruitment. You know, how many out there are looking for, we need to expand our primary care base, or I'm looking for a strong OBGYN or orthopede. We need to build either whether it has to do with that referral, or we need to have a specialist that is going to be on our staff or someone we're connected to. But they have to believe in us and our image. So it all, again, goes well beyond a logo. So when you think about that, if you're wondering, these questions that are coming up on screen, this is actually part of a process that we go through when we work with organizations. These questions, we look for a consensus on these questions from organizations. So when this one being, if you overheard a patient describing a hospital, your hospital or a clinic to a friend, what would they say? You know, word of mouth. Again, it goes back to it. You know, what do they say about you? You know, you're hoping it's positive, but what do they say? What's going on out there? So
We have one response. The staff took care of us like we were family.
there you go. It kind of plays into when we talked about the previous exercise. Family came up. I don't know if it's the same person that responded to that, but you're seeing common pieces there, that suddenly family is an element that we need to take into strong consideration when it comes to your image. And if we're not projecting that in communications, it is a piece that we should be looking at. Any others there, or otherwise I'll go on?
Yeah, so we have PEMSCA will take care of you. They're growing, expanding services, and friendly.
Perfect.
I feel, one more we have, I feel as if I know my doctors and nurses and trust they will take care of me.
Nice, nice. And that's the kind of stuff you're hoping that people are saying about you. So we're leading into who you are, what's your personality. And this is going to be leading into the exercise that we're going to do. When we look at uncovering your personality traits, why it's so important, I did mention it earlier that you do have to think about this as a person. You have to think about your organization as that, your image as that. We all have, with that, you have personality traits. With these traits, I mean, think about your friends. Everybody, friends and family, we all have personality traits. And those traits can be projected through verbal communications. It can be visual. You know, you got somebody that, you know, when you think about it, if you go down to the next point, your organization being described as a person can be traditional, it can be established, it can be innovative, it can be personable, it can be, that friendly piece of it. It can be fun at times, but it can be, there are kind of two sides of it that we look at. So when we look at your organization, and with that, we want to think about what I mentioned before. Where are we today? What is our personality today? And what do we want to be? It could be it may be an alignment that this is where we want to be. When I talk about aspiring to be is where you go back and you say, okay, when our organization started, we were, I don't know, I'm just going to make up a name, Valley View Community Hospital. With that, Valley View Community Hospital now has 4 clinics. They're now bringing in surgical specialties that they never had the opportunity to in the past. And in fact, they just found out that they are going to be expanding to a higher level of mammography. They do have the opportunity now for robotics. Well, does that name match the personality of your organization? Does that image match the personality? That people within the community say, well, that's Valley View. Valley View is a community hospital. If I need those type of things, I'm going to go 2 hours to the large health system, and I will have those services done there because that's where you're supposed to go. I heard that. My friend told me that, or that's where we've always gone. But the aspiration of who you want to be through your personality is going to transfer into communications. It's going to transfer into what your organization believes who you are. So let's go to the exercise. I guess the first question is, do you have the exercise? So with that, the PDF exercise that I provided, basically what we want to do is go to the second page of this. Within that, there is a chart that's in there. And again, this is an exercise that we take many organizations through. And with this, it's, as I said, it's a where you are and where you want to be. This is a quick exercise that what I want you to do is to look at this and within 5 minutes at most, go through this, place a dot, or take that back, place an X with where you believe, within that range, where you believe your organization falls. So if I look at that first line, are we personable and friendly? So are we off to the closer to that? Or are we closer to formal and professional? One thing that I would say is, as you're doing this exercise, the one place you want to avoid is being on the line all the time. I understand there are times that it makes sense that you're both, but you don't want to ride the line constantly because then you're kind of vanilla. It's like, okay, how do we project that image across? So take a quick look at this. As I said, go with where you were or where you are with the X, and then go with a dot with where you want to be. And then we're going to come back real quick and just kind of go through your answers with this, okay?
Looks like we have one person done, Vicki Bradstetter.
Okay, maybe it makes sense. Vicki, do you want to open up your line?
Yes.
Okay, hi, Vicki.
Hi.
Hi, would you be willing to just kind of share your perspective of where you are and where you aspire to be, if there's, just kind of go down top to bottom within your organization?
Okay, on the first one, I put that I believe we're personable and friendly.
Mm-hmm.
Not that we're not formal and professional, but I think in our small town, personable and friendly works better.
Yes.
And in situations where we need to be formal and professional, we are, but as a whole, we're right where we need to be.
Okay.
On innovative and conservative, I put that we're to the left of the line towards innovative.
Mhm.
And I just think maybe we need to be a little more innovative.
Okay.
Maybe go a little bit more left. Modern or high tech as opposed to classical and traditional. I think we've been classical and traditional, but we are inching over into modern and high tech, getting new equipment
Mhm.
and doing better. And again, I think we should just go a little bit more in that direction.
Yes.
Cutting edge established, where I put us closer to the middle on that one. We are established, we've been here for a while, but we are definitely moving in the cutting edge arena. So,
Okay.
and that again, go farther to the left. Fun versus serious, we're more fun, which goes with the personable and friendly.
Mhm.
Blue collar, and I think that's where we want to be. Blue
Yep.
collar, white collar, where our community is more blue collar, and that's where we fit in.
Mhm.
And I don't know on that one which direction we should go.
It's funny because that's kind of the one everyone is torn, is like, are you creative? Are you more of your mind more of just based on the systems and, the more analytic versus creative? And a lot of times this is the one that you meet in the middle on, because you really need both on that. So, but I'm not giving away answers. I'm just telling you that is one that organizations look at and kind of land in the middle on. So
Now, is that the blue collar or white collar, or the left brain, right brain?
left brain, right brain. Yep.
Yeah, I
Yep.
put us on that one almost right in the middle, but a little bit towards the right brain, because we can see the big picture.
Mhm.
And we like to be creative and come up with new ideas. So that's why I put us on that side.
Exactly. Okay. Thank you for sharing. Is there, I know that, I don't know, we probably have a couple more minutes that we could share. Is there anyone else that would want to share? You can let us know that.
This is Tina Poston from St. John Hospital.
Hi, Tina.
Hi, I pretty much came out the same way as Vicki in most of the categories. We are pretty much almost very close to being the same. The only thing that was a little different was the fun versus serious.
Mhm.
And I think our staff is a little more serious, and I think we need to move towards trying to make it a little more fun for people, considering what's going on with the pandemic and all. People are just very serious and very
Mhm.
stoic in some cases. So it's something we need to try to relax sometimes. It's hard to move forward when you have such heavy things going on.
Yes. Yeah, totally agree. I mean, you're definitely not alone with that. It is the fun piece goes back to, there's a time and a place to have that fun.
Mhm.
And even right now, we have to be very sensitive of what we project out as being fun.
Right.
But it is that, again, aligns with friendly.
Sure.
So yeah. Okay. Thank you for sharing that.
Mhm.
I would like to hear, actually, let's try one more. If one more person is available, be happy to go through that. Otherwise, we'll jump ahead here. Okay, well, we'll keep it going here. With that, I guess the first question is, when you look at the answers that are on the screen there, or I should say on your, basically the form that you filled out, within the PDF, I mean, does it align with your image? When you think about your image presently, is it in alignment? And I think this is when we go through this exercise, as I said, we look for consensus to say, we see trends that are here and everyone that is involved. And when I talk about this exercise, we're working with communications teams, we're working with leadership teams, and sometimes board of directors are part of it too. But we want to make sure that we're all the train's going in the same direction. And if we start to identify that maybe there are some changes that need to occur within your image to align with this, that's where we have to head. One of the first things that we look at is consistency of your image. Sometimes it's just as easy as this. It doesn't mean you gotta run out and we have to do a new brand identity. We need to invest largely in a lot of pieces. We just need to be more consistent in the way that we project our image to in-person, online, through to communications, internally, externally. We understand what we stand for. An organization that I worked with previously, as when I was VP, and as mentioned, our logo had a leaf on it, and we had to basically live the leaf. It didn't mean we lived the logo. That leaf represented a lot of things. It represented the promise that we had for the organization. And any person that joined our organization had to go through orientation of what that meant, so that every person was on the same page of what that promise was with that. So that plays into image consistency, so that everybody knows it. So if somebody asks you, where do you work, whatever it might be, you understand it. But then there's also technical pieces that can be created, like standard guides. A standard guide can really make sure that it's communicated. What's the mission? What's the vision? What are the values? What's the essence of your image? What does it stand for? What's your character? All of that can be placed within this, but then it can get into some of the pieces that are sometimes played into outward facing communications. The logo, proper usage, color palettes, typography, voice and tone. How do we write? How do we write a communication? What does our voice sound like? Again, it goes back, are we friendly? Are we going to be, do we push in a little bit more of the high tech feel into it than when we're making some of the communications of this, that we're more innovative? Our photography styles that we're using, what is that? That it matches the personality. Your hierarchy of your locations. Is it confusing right now that you need standards because I'm at the hospital, but then I go to the clinic, but then I go to the pharmacy, or maybe I have a nursing home, or there's other elements that are part of your organization? How does that main image of whatever that hierarchy fits, so that whatever experience people are going through, they recognize it's all part of the same organization? And then as part of this, we usually throw in actually samplings of work, so that, again, anything that's going outward facing has consistency within it of that. And then at times we include, like what Aaron had in the last presentation, talking about some of the policies, social media policies, including that in there, so that it's a go-to resource within that. So this just on screen gives you an idea of, this is just some interior pages that off to the left gets into logo standards, colors, layouts. Everything is consistent on your print samples. These are somewhat templates, but they are kind of go-to things that we understand that we have a unified voice going across. We talk about, again, it's standards. This is the piece of saying who we are. It's actually something that we've actually created smaller books like these that all, whether it's through a PDF or it's a presentation, all staff understands. They all receive this within it, so that again, our image is the same to everyone. And then obviously the standards that I talked about within this. So trying to create that consistency. So this is, as I said, kind of the foundation that many times we find organizations, as we go through this, that's maybe where you have to head first to be able to steer that ship in the direction that's matching your personality. But here's that big question: is it time for something new? When you do that, you got to take things into consideration, the degree of change that occurs. And I'll talk about that in just a second. The risk that could, when I say risk, change is risk. You may have equity right now in your name, and you walk away from that, and you're going to have people in the community say, well, I don't care what they call it. That's where I go. I'm going to keep calling it that no matter what. Current perceptions, you want to retain that perception. Do you take on a name that's literal, or do you go a little abstract? Something, and I'll talk, you'll see some of these in just a second. I already talked about the multiple locations, the multiple names. How do we bring that together into a hierarchy or an architecture that works? And then another key factor you have to think about is sustainability. Don't be reactive to it. you know, thinking we got to do that, we got to make this change. It's got to be with reason. And I think as you look at this, look at where your organization is going, it may make sense at that point that image change is there. But when I talk about the degree, we look at it as two different levels: image evolution and image transformation. And evolution is where you're just evolving. It could be the logo. It could be a slight change to your name and colors. And it's also developing those standards that I talked about. Or it could be a complete transformation. We need to take a look at the organization as a whole. We need to say, potentially, our name may be affected by this. The logo, yes, will change. And obviously those things below are things that will follow because we are making changes like that. So when we look at an evolution, the Illinois Critical Access Hospital Network, they had this logo, and in some ways, I hate to say it, the colors are like back to the 90s of burgundy and gray, and they were running into some issues of reproduction. But the way they wanted to project themselves to their members and was really to try to put more life back into the organization. They also were looking for standards too, because again, it was all over the board in ways that things are done. So you can see, this is just an evolution. It's not a big change, but through color and through strength and through just kind of more action into the image, that's what that portrayed who they were today. One Cura Wellness is based on, it's a number of hospitals in the Oklahoma area. But you think of the word wellness, I'm not thinking hospitals and clinics, I'm thinking something else. But the One Cura name had equity. So don't walk away from it. Health really captured what they were. The hands that were holding the Oklahoma fields didn't do that because people thought they were like deer antlers and things like that. So we did not retain that, but we gave that same essence to the image. Oops, sorry. All right. So an image transformation. This is where you see the big change. Paris Community Hospital, Paris, Illinois. With that, they had a pretty long name that was there. It tried to capture both the hospital and the clinic. And with it, it didn't match the footprint of their organization. Much larger area that they're trying to cover within Illinois. It worked at the time. Paris was, and Paris Community was it. But now they needed to really cover much more of a geographic area. Again, be the more succinct, much like it was with One Cura, utilizing health. Use a name that maybe is a little bit more abstract, that it's not just taking Paris and going Paris Health. And really taking on more of a contemporary feel with it. So it really encapsulated all services, worked well for a hierarchy of offerings. Atchison out of Kansas, Atchison Hospital, this is just a recent one we just worked on. Again, same type of thing, same situation as Horizon, have grown so much. But with that, when I talk of something that's a little bit more abstract, you say Amberwell, what the heck does that mean? Well, when we went through the exercise, wellness is what they are talking of their future. The way they provide care, the way they manage care is going to be built off of wellness. Amber, that's the state gem with that, or mineral with that. So it is something that, and ironically, it was just declared that over the past few years because they didn't have one. And so it is newsworthy that a lot of people know that. And the waves through the leaf is actually from the previous logo. It's been brought forth over, you can see the shape, it's the same shape. And these amber waves are through that, but they're not amber, they're blue. But they represent the clinics, the hospital, the vision, the mission within the organization. Osceola looked like it was a heart hospital, and it's not. They wanted to also retain Osceola. It had equity. But community hospital versus regional health center was a big difference for them. And then also, again, the personality of the brand is much more contemporary. Yes, it's an O, but each sweep of those O's represent, again, the values, the mission, things like that. So it's with purpose. So with that, what we've learned today with this has been obviously number one, that it goes well beyond, your image goes well beyond a logo. It's a promise that's there. You need to build equity in that through experiences, through communication, and ultimately that leads to awareness and defines your character with that. Hopefully the exercise that I gave some insight of what you aspire to be with that. And you know, maybe this is the type of thing you need to share with it, to say, you know, maybe it is time. But it could just lead to, as I said, as simple as standards that could strengthen your equity of your image across all audiences. You know, but then I also, as I said, there are a lot of factors. If you end up leading into making a change, you got to think about these things. It is a big thing. But ultimately, if it's time for a change, then you have to think about the degree of change with that. So I hope you've learned something here today on this. With that, I think what I'll do first is, you know, run the poll here and see, you know, where things are coming at with this. And as that's going, obviously next week, we're going to be talking about telehealth. As mentioned, I realize there are many organizations that of you that are either bringing that on or looking at that. So we're really going to be looking at, how do you communicate that? How do you communicate it internally, externally, and build confidence in the use of telehealth with that. So. Again, unfortunately, I'm not seeing the poll on screen, so you're going to have to give me some insights there, Robbie.
All right, we're at 18 of 44.
Okay, good, good. All right.
All righty, I'm ready to end it.
Yeah, so I guess before we end here, I don't know if anyone has any questions. I'm not quite sure what the time is here. Basically,
I have
two minutes.
left.
Ooh. And I would say, if you, even if from a question standpoint, if you do have questions, you know, much like what Mike has said and Aaron has said, you know, we're definitely, you know, happy to, you know, answer any questions directly. If you want to email, obviously my email's on screen. Obviously, I'm working off my cell phone right now, even though I'm in the office today. But we definitely can, you know, be happy to talk to you further about your image or about really anything that we've talked about up to date, if you have any questions. Okay. Anything coming in, Robbie?
Nothing in the chat.
Okay, all right. Well, I appreciate the time today with this. And as I said, I hope you learned something about this. And I know Legato, we look forward to sharing a couple more sessions here in the next 2 weeks. I'll be back again in about 2 weeks to talk about storytelling.
Okay.
I'm not going to tell you stories, but we're going to talk about how that can be worked into communications. So that would be it. So I hope you have a good day and look forward to seeing you again. Okay.
Wonderful. Thank you.
Thanks.
Thank you.
Thank you.
Yep.
Thank you. It was a very enlightening to see, to be reminded of the importance of making the patients feel welcome, as well as the staff feel like they're home.
Thank you, Geneva. Yeah, that's it exactly. Yes. Thank you.